Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you would like to ask a question, you can click the Raise Your Hand button. When you're called upon, we will unmute your microphone, and you will have to unmute your own microphone. Thank you.
Good afternoon. Thank you for joining us again today, and I also want to thank you for all the sacrifices that you've made over the last number of weeks, going on more than a month now. Your actions, I can tell you with certainty, have made a difference, a positive difference on where we find ourselves today. I believe that Indiana is, quite frankly, faring better than some other locales around the world because we got at this quickly. We got at this early when we first saw signs of what was to come. Others did not play defense quick enough. And so we learned very early on that swift action would make a noticeable difference. That effective defense is ultimately going to allow us to get to a equally productive offense quicker than I think some other locales will experience as well. That's why we've been so focused on last week and this week and next week's numbers. They will drive the decisions that we make on the ground, and we'll continue to be very transparent about those numbers. It will be the case this week, at the end of the week on Friday, just like I've done in the past, to look at tweaks on our Hunker Down Hoosiers executive order. It will expire at midnight on Monday, next Monday, but as we go into the weekend, as Hoosiers across the whole state of Indiana, I want you to know what we're seeing and what we're doing going into the weekend before they go into full effect. We will be able to do that because of, again, the actions that we've taken, because of the progress that we've made in our ability, quite frankly, to care for those who are in need, our ability to ramp up our capacity to care for those who are in need, and then also the actions that we've taken to contain, to mitigate. We knew this would work. We knew this was the most important tool and action that we could use and take. And to date, we can see that progress. But at the very same time, as we've said every day, we've said that this can spread, and it's spread into all 92 of our counties. Benton, Pike, and Perry were the remaining 3, but it's in all 3 of those counties now as well. We see the spread here in the state of Indiana, and we see how fast it can spread in places all around the country, all around the world. We've got reports recently out west in South Dakota where a meat packing processing plant has 238 positive cases in that one plant. There's some in Iowa now as well, and Colorado, which ultimately could threaten our national meat supply. And what we do know is we need these essential businesses, whether it's meat or medicine, long list, to be up and running, and we can't allow ourselves to fall in a situation where our national supplies are threatened as well. And so we'll continue to focus on, as I've described in the past, the 4 quarters of this, and we're still in this, first quarter, the mitigation phase of this all. We'll also move into that second quarter, the surveillance, which really just means being able to track contact tracing of folks who have been determined positive, and be able to follow them so we know when we can get them back into the workforce. And that third quarter is when we're all working, and it'll be different. It'll be a different scenario, a new normal. There'll be different standards in terms of hygiene and cleanliness, and some that will have to wear masks, et cetera, a long list that we'll get into more as the week unfolds. And then ultimately back into that fourth quarter where we're all growing again. So we're still in the woods, but the good news is that we can see the clearing ahead. And it's only because of the efforts that we, managing that surge, managing that peak, has to do with us, you, me, us, together. That's how we bring that peak down to a level where we can continue to, as we have to date, care for those who are in need and get us out of the woods into the clearing. And with that, a more up-to-date, minute-by-minute lay of the land, I'll turn it over to Dr. Box now.
Thank you, Governor. Good afternoon, Hoosiers. As you can see by our dashboard today, we added an additional 7 new deaths, unfortunately, from COVID-19, with a total of 331 cases. These numbers are lower than we've seen in recent days, but I don't want you to read a lot into that. Oftentimes over the weekend, we see that labs and hospitals batch these numbers and send them to us. Also with the holiday weekend, I think that could definitely have affected some of the reporting. So I expect to see those numbers go up over the next several days. As you may have noticed, our online dashboard looks a little bit different than it has in the past, and so we want to start each day kind of updating some of those numbers. As we look specifically at the numbers, it's important to note that this is a very interactive dashboard that you can actually toggle on the state of Indiana. You can go to any individual county. You can actually look at the number of tests that are done there, the number of positive tests, and the number of deaths for that county. So that's a very interactive map. I hope you take a moment to go to the www.coronavirus.indiana.gov website and look at that. We did our case demographics by race, which really haven't changed much from when I reported last week, with positive tests being 17.8 for our African American population, and our white population about 50%. Our Latino population at 3.4% continues to have a significant amount of data that is missing there. As we go further into deaths by race, you can see that about, unfortunately, 21% of our deaths were in the black population, and they make up about 9.8% of our population, and our white population, about 65% of the cases were in the white population in our deaths. The Latino population had about 1.4% of those deaths. We will continue to look at those and report on those at a weekly basis. We're going to continue to give you ICU bed updates with regards to our dashboard on a daily basis. As you can see, we still have about 44% of our ICU beds that are available, with about 25% of our beds in use being used by COVID patients and 31% by non-COVID patients. And then when you go on to look at our ventilator status, you can see that about 73% of our ventilators in the state are open and ready to be used, and 16% of those being used are used by COVID patients. When we talk about capacity, what we're concerned about most is the surge capacity that we have and what we expect to see with regards to COVID-19. Our earlier modeling indicated that it could come as early as this week. As our social distancing measures and requirements have taken effect, it has really made a change in our models, and that we are now expecting that surge potentially at the end of April for probably Marion County first, based on their numbers, and then other parts of the state in the first couple of weeks of May. Again, the fact that these models are changing are specifically related to the effects of our social distancing and the success that Indiana has had, along with a lot of the other Great Lakes states. What this also means is that we can't relax our guard. Social distancing is still absolutely critical to our overall goal of making sure that we don't overcome our healthcare system, to not only delaying that peak, but flattening that peak so that there is a smaller burden on our healthcare systems overall. We continue to work with our partners across the state to prepare for whatever that surge looks like, and I want to share some positive updates. As you saw last week, we launched our first drive-thrus, and we did over 900 tests in Maryville in that 1-week period of time. Over 4 days, we were able to test those 900 people and are getting those results out to them, but we did see about 12% of those early tests coming back positive. We're still gathering that data, and we'll be reporting further on that. Today, we stood up drive-through testing in Sellersburg, Evansville, Fort Wayne, and in Gary to make sure that we are reaching areas that we know have significant disparities in populations and making sure that we are testing everyone across the state. None of these efforts would be possible without the incredible partnerships that we've had with regards to Eli Lilly as they continue to make the much-needed viral transport media and supply swabs for us. In Maryville, we were also very grateful for the partnership that we had with Maryville High School. The school superintendent took incredibly good care of our team up there, even bringing a school bus in and running it so that our workers that were getting very cold out there were able to go in and get warmed up between testing patients. We even had volunteers bring food to the site for our volunteer workers that were there. And we've been very, very blessed by the fact that the National Guard is contributing on a regular basis to the 4 sites that we have up and running today. Ivy Tech has also been bending over backwards to help us in Sellersburg and in Evansville. And as I mentioned, the Guard is really helping to provide that essential manpower. Our local health departments have been engaged and very excited to be helpful in this process also. Also, I want to thank the people that have sat in line to be tested, because I knew that there were some times where that took a little longer than you would have liked. So thank you for your patience, and thank you for taking the opportunity to get tested. We also received positive news this weekend from the Strategic National Stockpile in that Indiana did receive 100 new ventilators. So we are in the process now of working with our hospital systems that have indicated to us that they're using ventilators that maybe are not meant to be ventilators, but more ventilators for a surgical procedure, and so that we can switch some of those out, or hospital systems that have added extra ICU beds and really need ventilators to support those. Finally, I really want to express my intense gratitude for the people and companies who have donated so much of the personal protective equipment to help our healthcare workers. You're going to hear more about that shortly, and I want to give my personal thanks to everyone that has stepped forward to not only donate, but also to produce this personal protective equipment for the state of Indiana. I think there's nothing more important than making sure that we are protecting our frontline healthcare workers all across the state. Thank you very much.
Well, that's a perfect segue to who we will hear from next, but which will be the Secretary of the Indiana Economic Development Corporation, Secretary Jim Schellinger, and his Chief of Staff, who you've turned into more of a procurement officer, Luke Basso, over at the IEDC as well. They are dealing with making sure that our readiness level is up to date and up to the ability to respond to this pandemic on a not just day-to-day basis, but an hourly basis. But let me also just quickly say, I believe that the unprecedented challenge or challenges that is before us right now has revealed the true Indiana ethos. I believe this gets to who we are, who we aspire to be in this time of challenge. And you look no further than on a daily basis the incoming offers to help, the good people, the good acts who are acting very creatively, whether it's in their home or on their factory floor, whether they're very close to the hot spot or very far away. Just look at what is happening when people put the common good above their self. This is how we're able to flatten the curve. This is how we're able to slow the spread. And it has been inspiring, quite frankly, from day one to see the number of acts of generosity that are coming our way to Indiana. And our level of confidence is heightened because we did act early, we did act deliberately, we did understand that mitigation would work, that good defense was necessary to start to play offense again. And when you think about that Indiana ethos, the who we are and the coming together shoulder to shoulder, from the folks who are manufacturing the PPE to the folks who are paying for the PPE to the folks who are wearing the PPE, so that they can all be able to care for those who are in need, so that we sail through this storm as swiftly as possible. We're eternally grateful. And what folks have done has really separated us as an exhibit on how to approach this. And so with that, no pressure, I'll turn it over to the Secretary of the IEDC to put a little detail to those comments.
Thank you, Governor. As the Governor said on many occasions, the IEDC has become sort of a concierge, doing a lot of different services. And today we're here to talk to you about the efforts in PPE. My Chief of Staff, Luke Basso, is going to review all the things he's done over the past 3 weeks with his team. And I'll tell you, it's been unbelievable to watch this team at work and to see what their efforts have produced. So with that, I'll turn it over to Chief of Staff, Luke Basso.
Thank you. As the Secretary said, I'm Luke Basso, Chief of Staff of the Indiana Economic Development Corporation. For the last 24 days, the IEDC has transformed into a concierge service working with businesses all throughout the state. We have been contacted by numerous Hoosier businesses willing to help. And today, I'm pleased to announce we have purchased 1.9 pieces of PPE from Indiana businesses. Currently, we are working with 15 Indiana companies who are making face shields, gowns, masks, and more. The companies we are currently working with come from all around the state and from a variety of sectors, like the Rohr Corporation in Madison, who normally produces products for restaurants and bars. They have transitioned into making face shields. Or Tiedemann Bevs in Richmond, who usually works in the casket industry, who are now making gowns. You'll hear from more companies shortly, but it's Indiana companies like these, and Berry Global in Evansville, Top Stitch in Elkhart, and Williams Distribution in Indianapolis, who are helping Indiana receive enough PPE to get through this pandemic. Here's what we've ordered from Indiana companies. Over 763,000 face shields, more than 68,000 gowns, over 1 million face masks, 10,000 goggles, more than 6,700 bottles of hand sanitizer, and over 141,000 gloves. To date, we have received and distributed over 200,000 pieces of PPE throughout the state. We expect to receive more than 150,000 pieces of PPE this week with deliveries daily. These Indiana businesses have stepped up in a big way to make PPE. We are lucky to have several other private sector partners donate PPE to the state as well. Special thank you to everyone who has donated, including the Indianapolis Colts, Toyota, Fiat Chrysler, Westfield Outdoors, Rally Health, and Acclaim Graphics. Together with numerous other donors, the state has commitments of over 440,000 PPE donations and has received 149,000 to date. In total, with purchases and donations, the state has received commitments for over 2.6 million pieces of PPE and has received over 375,000. As the governor likes to say, we aren't done yet. Every day, the team at the IEDC is in contact with more companies who can help fight this virus. If your company is making PPE or you'd like to learn more about making PPE, please email covidresponse@iedc.in.gov. Finally, I would like to thank the Indiana Department of Transportation and the Indiana National Guard for supplying logistical support in picking up and delivering PPE from Indiana companies. But most importantly, I'd like to thank our colleagues at the Department of Health and all the frontline workers who are fighting this virus on a daily basis. Now I will turn it over to Secretary of Commerce, Jim Schellinger, who will introduce you to two companies making PPE. Secretary?
Thank you, Luke. We all know the difficulty and the challenge of these times and the challenges we're faced in these times for many Indiana employees and employers across our state. That's why we are so heartened every single day to see tremendous efforts across the state from the private sector. Companies across the state are reaching out to each other, to every day to us at IEDC to offer their support and to see how they can help others. Governor, today, we are lucky to have two of those businesses joining us virtually. First, I am pleased to introduce Pat Jordan, the owner of Jordan Manufacturing, based in Monticello, Indiana. This company is a long-time provider of outdoor furniture textiles and has shifted production to support our medical workers. Pat, welcome and thank you for joining us today.
Good afternoon and thank you. I'm Pat Jordan, Vice President of Sales and one of the owners of Jordan Manufacturing Company. I've worked for the company for over 35 years now and done everything from sweeping the floors to stuffing cushions to orchestrating our current partnership with the state of Indiana during this pandemic. Jordan Manufacturing is a very big little company that has been incorporated for 45 years now. For 35 of those years, we have proudly been a Hoosier company, and our corporate headquarters are located in Monticello, Indiana. We also have a secondary manufacturing facility in Kentland, Indiana, as well as a third plant in Yuma, Arizona. Traditionally, we are a cut and sew operation for outdoor patio cushions, umbrellas, curtains, bean bags, and a myriad of other products. We have about 30% of our production is dedicated to e-commerce customers. When this whole pandemic started, back I think on March 23rd, after Governor Holcomb called for the citizens to do their part, we as a company made the decision to respond to that call. As a corporation, one of our core values is families, not only our own families, but the work family here at Jordan. And because of these families, we decided that it needed to be a priority to help our neighbors, first responders, healthcare workers in both Indiana as well as Arizona. As a domestic sewing operation, we felt that we could shift our focus and react quickly to producing the level 1 gowns and masks. Behind me, you can see one of the gowns that we're currently supplying the state with. Part of the holdup for us was getting the first round of 30,000 yards of fabric into our facilities. So it took us approximately a week to get Monticello up and running, and about a week and a half for Kentland. We also had to redistribute our employee skills and shift them from departments as needed. Currently, we approximately employ 620 people domestically. These domestic employees are working hard to produce over 3,000 gowns and over 2,000 masks on a weekly basis, and that number continues to climb. We've always felt that our employees were our greatest assets. And being an Indiana company, we felt that we could help, our current Hoosiers that are in need during this COVID-19 crisis. But we also want to be part of the permanent solution to the dependency that we have on foreign nations for essential products. While our focus is getting through this crisis as quickly as possible, we also would be remiss in not to consider the impact, though, that it has on our lives. And again, we want to be part of that long-term solution for Indiana. Thank you.
Thank you, Pat, and thank you for stepping up to answer the call to assist your fellow Hoosiers. Next, I would like to introduce Andy Kitson of GDC in Goshen, Indiana. This woman-owned business typically serves clients such as Ford, Toyota, GM, and Trane. But today, they're supporting production of personal protection equipment. Andy, thank you. Welcome. Thank you for joining the call today.
Thank you. We're excited about all the developments we've had with the state of Indiana. GDC's been a company since 1955 based out of Goshen, Indiana. We are an automotive company, 95% automotive. We provide die cuts, molded plastics, and a melt-blown acoustical insulator to the automotive industry. So as this pandemic unfolded, we were concerned, and we met with our local healthcare workers and to find out how we could utilize our production and our engineering capabilities to help them. And one of the items that they were really, really worried about were these face shields. like the one I'm holding in my hand. And so one of our associates named Dan Emery, within 24 hours, not only had a prototype, but he also had a plan for us to manufacture 4,000 of these shields a day. Our objective was to make an effective and low-cost shield. So we reached out to Jackie Leworski's office, who put us in contact with Luke Basso. And within a few days, working with Luke's team, we had an order for 60,000, which was our first order. And this was perfect because we did not want to work through middlemen. We're not a retail shop. We make parts. And it was great to work with the state. It was a perfect fit for both of us. So now, a few weeks after, we're actually making 30,000 of these shields a day, and hundreds of thousands of these shields will go to the state of Indiana through this partnership. At the same time we were working with the state of Indiana, our customers reached out to us, and they knew that we made a melt-blown acoustical product, and this is the same process that filtration's made for surgical masks, like the filtration I have here in my hand. It's just a melt-blown polypropylene. So our team at our Elkhart plant, led by Doug Troyer, repurposed our machines, our melt-blown lines, to create this media that's so important for these mask manufacturers. It's very hard to get. So currently, all the masks made by Ford and GM, who are ramping up to make 1 million masks a day, are made right here in Indiana. The filtration media is made here, and we're committed to working with them and other companies, other mask makers, and getting them this very important media. Our plant is working around the clock, and we're currently making enough media every day for 6 million surgical masks. So it's a very important job that our team in Elkhart has. The other thing we worked on is there's been a lot of people, a lot of groups, a lot of companies that have made these fabric masks. This is one that I've been wearing, and these are great. They're wonderful. People dress them up in a lot of different ways. The problem with these is that as you're wearing them, I have allergies. A lot of people have allergies, and you cough throughout the day, or you might sneeze, heaven forbid, and it would soil this during the day. So we came up with a product that utilizes our filtration media that you can actually place into the mask. You can see this is what I've been wearing, and I put this filtration media right here so that if something would happen, I would cough, I would sneeze. It's going to do its job and catch the mucus and everything out, the nastiness. And it's made out of a polypropylene, so it's naturally hydrophobic. And you can just remove this and throw it away and dispose of it properly, and then put a new one in, and then you don't have a soiled mask for the rest of the day. We worked with Goshen Hospital on this, and they're currently using 7,000 of these inserts a week. Those are just a few of the things that we're trying to do to help this state and this country through this pandemic. And I can't tell you how honored we are to be working with the state of Indiana and how easy they've made it for us to get these things quickly out to the public and to these healthcare workers. Thank you.
Thank you, Andy. And what you're doing at GDC is absolutely remarkable. And we appreciate your enthusiasm, which is contagious to our team. Governor, these are only two companies of very many examples of incredible work Indiana businesses are doing throughout the state. I know Luke Basso, IDC Chief of Staff, touched on this, but I want to touch on it once more and reiterate that the commitment and dedication of Indiana's private sector has been outstanding. We have 15 Indiana businesses that are manufacturing or shipping 1.9 million pieces of PPE. Over 440,000 of those pieces have been donated by companies from Indiana. And Governor, as you know, just an hour or two ago, Raleigh Health Executive Grant Verstandig reached out to us to donate $150,000 to the IDC so that we can purchase over 53,000 face masks, shields, and gowns. And we expect these numbers to continue to grow. Our team at IDC has been in conversation with more than 500,000 companies that have pledged their assistance and their support for us during this crisis. Every day we hear from Indiana businesses, employees, nonprofits, and everyday citizens that are asking us how they can donate unused PPE to help with the medical workers, and to help those impacted by COVID-19. In this time of challenge and uncertainty, we've seen businesses and Hoosiers step up together like never before. All this to say and to reinforce, you can't keep Hoosiers down. And that's why I'm so confident to once again give you my word that as we continue to move to the new norm, we will take Indiana economic development to the next level in Indiana, a state that works for everyone.
Thank you, Mr. Secretary. Thank you, Luke, as well. Thank you to Jordan Manufacturing and GDC. Obviously, this, and to all those companies, you mentioned Raleigh, but all those other companies from around the state, around the country, they embody that Hoosier ingenuity that we're famous for. And talk about operating at the speed, not at the speed of business, but at the speed of the need. This is impressive. And when we send out the help signal, people come running. And this is allowing us to, this is not an overstatement, to save lives and to care for those who are in need. And that means we're going to get back quicker to our full workforce potential. And I hope save a lot of lives along the way. So with that, thanks out of the way for the day. We'll jump right into the questions that you may have on your mind.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Thank you all very much for being with us today. Two questions, one for Dr. Box. With the data that you gave us saying maybe we're looking at maybe the surge at the end of the month or May, what data are you folks looking at that's different than maybe that some of us see publicly, the IHME? And for you, Governor, any worry concerned about lawmakers revolting or maybe some Hoosiers getting antsy? One state rep is talking about legislation to limit your ability to declare emergencies. There's, I guess, a scheduled protest on Saturday at 3 o'clock at the governor's residence by some folks think you may be expanding your authority. I'll stop talking.
I'll take the first one first, and I'll take a crack at the.
So I don't want to give an exact date, but we're kind of looking at the last week of April into the first couple of weeks of May with regards to Marion County and then other sites across the state of Indiana.
And I would just say that not only do I sympathize, I understand where Hoosiers, including lawmakers, who have a vested interest in representing their constituency, about this new normal that we find ourselves in. Obviously, we'll seek to work with our legislative partners as we have from day one. Obviously, we don't want to jeopardize our relationship with the federal funding that's coming our way, that a lot of our executive orders have centered around making sure that we have the proper timeline, the proper safety measures in place to be able to mitigate, to be able to reach Hoosiers that are in need. So we'll continue to work with them, but we've acted constitutionally throughout this entire process. And you know, if we disagree about that, then I'd be more than welcome to sit down with anyone that wants to go over the Constitution or see where our authority is derived from. But I'd like to agree with them if it's a constitutional issue, but if I agreed with them, we'd both be wrong. And so we'll continue to carry on with making sure that we're doing everything that we can on a timely basis to get us through this and back to work safely.
Jeff Smith, WLFI.
Hello, Jeff. Good afternoon.
Good afternoon, Governor. Good to speak with you again.
Yep.
Hey, as you and your task force look to the day that things could start reopening, what's your President Trump tweeted this morning that the president has the authority to do that. What's your understanding about Indiana's role to act independently of what may or may not be happening nationwide?
Well, we want to, of course, we want to remain not just in line with our state authority, but also understanding the balance, that it's the balance between federalism and states' rights. I think the president has Hoosiers' best interest in mind. I don't think he wants to, nor do I, act prematurely in getting back to work. He's looking at the same data that we're looking at. I, in fact, spoke to the Vice President, Pence, yesterday, or 2 days ago on Saturday, about the very data that they see, and it's the same data we see. That's the beauty of being transparent about all this. That's the beauty of being connected on an hourly, daily basis, not just me, but our whole, as you mentioned, task force, whether it's with FEMA or Homeland Security or the Army Corps or you name it. We're all in this together. That's just not a catchy slogan or phrase. That actually is true. And so we'll continue to work with the president and his team, look to them for CDC guidance along the way as this virus changes and mutates and evolves, and as the waves are crashing on the shore of states around the country. The country, just like our state, we've got 10 health regions in the state of Indiana. They're all affected differently, but they all can be and are affected. And so we have to be able to respond in real time to what those actual needs are. So we'll continue to work with the administration as we have to date.
Mary Mills, WTHR.
Good afternoon, Mary.
Hello, Governor. A couple questions for you. First of all, where are we at in terms of unemployment filings? What are you expecting and how prepared are you for those numbers? And also, where are we with the number of small business loans processed? And then Dr. Box, I've got a question for you as well related to the Bethany Point Nursing Home. Last week, you mentioned that there were, I believe, 24 deaths at the facility. Were those patients, employees, or both? Because the dashboard lists 15. So we're just curious whether those deaths are being counted in other counties.
Why don't you take the third one first, and then we'll go back.
Sure. That is a combination of patients and employees, I believe, but I can check with that. But it may be a little bit different because some of those individuals were suspected COVID-19 deaths, not necessarily tested positive COVID-19 deaths. And there is a lag time in when the hospitals sometimes actually report those deaths to us. So that may be the difference in what you're seeing with the dashboard.
And Mary, let me, before I kick it over to Fred Payne at the Department of Workforce Development, let me just say about your second question. We intend on having the Dean of the Delegation, Senator Todd Young, here tomorrow. He'll be specifically talking about those SBA loans and the banks here in the state of Indiana and the status or the progress that we've been able to make on that front, in addition to other aspects of the CARES Act. So he'll go more in depth about that tomorrow. But we do know of banks that are working right now directly throughout the state of Indiana, directly with our small business owners. We think this is a critically important piece to getting from the second quarter to the third quarter to the fourth quarter, back to that growth, is making sure that our employers know that there is the ability to hire back on or keep their employees. So they have that team in place to hit the ground, or the court in this sense, running from right now until 2 weeks, 4 weeks, 2 months from now. Fred, you want to talk about how the 131,000 or how it was downward, you adjusted it from last week to this week and where we are currently in terms of our unemployment insurance benefits claims?
Sure. So we did have a reduction last week, the week before. The numbers that were reported last week were down a little bit from the previous week, somewhere between 13 to 16,000. We may see similar numbers this week. We'll release those on Thursday. But what we can share with you today is that the number of filings have been consistently over 120,000 per week for the last two and a half weeks. We don't anticipate that number going down anytime soon. Our system has been working well in terms of accepting claims. We still continuously have high call volumes, and we are having some difficulty and some concerns with our call volumes that we're actually addressing on a daily basis.
Thank you, Fred. And Mary, thank you.
Rob Burgess, the Wabash Plain Dealer.
Good afternoon, Rob.
Hey, Governor, how are you today?
Good, thank you very much. And yourself?
Oh, I'm great. Thanks for the opportunity. I always appreciate it. Dr. Box, our local solid waste district has said these PPEs, such as masks and gloves, should be treated like biohazard waste and not just regular trash. Maybe if anyone else wants to jump in too from the manufacturers there, but can they be safely washed and reused? And also how, where, and how often should these be disposed of?
So if you're talking about PPE from hospital systems where we're actually dealing with known COVID-19 patients, especially those that are interacting with patients that have procedures and other things like ventilation that can typically bring about more aerosol procedures, those would be disposed in our red bags, and hospital systems know how to, as do emergency rooms, ERs, everyone knows how to manage that and how to dispose of that. If you're talking about the masks that individuals are wearing out every day, you can wash that at home easily, because again, that's to try to protect people that you come in contact with, to make sure that you don't inadvertently infect someone that maybe you might potentially be an asymptomatic carrier. We were talking a little bit about an insert inside a mask, and I know that people have been using something as simple as a paper towel inside their mask to try to soak up any secretions and then throwing that away. And again, that's fine, because again, the purpose of that is we don't think you're infected, we just want to protect you from potentially infecting someone else.
Thank you, Rob.
Jenny from Wish TV.
Good afternoon, Jenny.
Good afternoon, Governor. Just one question. Indiana is making vote by mail available to everybody for the primary in June. Well, the president, he's repeatedly expressed that he opposes such a plan and that it leads to voter fraud. Do you think that the vote by mail is safer in Indiana, and would you consider using it again in November if we still face a threat from the virus then?
Yeah, we're in constant discussions with both the major parties here in the state of Indiana and obviously with the Secretary of State. We want to make sure my standard is our elections need to be safe and they need to be secure. And the federal government, to their credit, has already forwarded a lot of funding, the appropriate level, I think, to be used toward conducting our elections in both a safe and secure manner. Those details are being negotiated right now on that June 2nd election, obviously having been delayed, but also looking forward to that November election. So we want to make sure that the steps that we take set the right precedent, and I'll look forward to having Secretary of State Connie Lawson with us at some point in the future, whether she's remote or at this table, to update us on how people will be voting in the state of Indiana, and we'll wait until then to share the final details as they're agreed upon.
Cater K, Wayne TV.
Good afternoon.
You have to unmute your own microphone.
All right, thank you, Governor. My question is for Dr. Box. So there are 2 nursing homes in Fort Wayne raising concern for our community. One has confirmed cases, the other we're waiting on confirmation from. I'll start with the first. So Life Care Center of Fort Wayne on April 8th confirmed 6 cases of coronavirus amongst residents and associates. We wanted to know if there's any updates on their facility as far as new cases, deaths, or major actions being taken.
Dr. Dan, do you have any updates on that for me?
Hi, Dan Ursiniak, Chief Medical Officer for FSSA. We are aware and have been in contact with Life Care daily. I don't have any updates from today, but we do have folks who are in contact with them today, and we'll get that new information probably shortly.
And then have you heard anything from Bethlehem Woods Nursing Facility? We've been getting a lot of reports that there is a case there.
What's the name of that one?
Bethlehem Woods Nursing Facility.
That's not one that's in the front of my head, but we can look into it in our list and see if we have information on that.
Whitney Downard, CNHI.
Hello, Whitney. Good afternoon.
Hello and good afternoon. My question is also about some specific nursing homes. We have the 2 in Anderson County, or in Madison County, Bethany Point and Summit Health and Living. You know, what's kind of the update on what's happening there? Are there any testing updates? Is strike team still there? What are the numbers that we're seeing from those 2 facilities in Madison County?
I think Dan's coming back to the podium.
Which were the facilities again?
Summit and Bethany Point.
Yes, Bethany Point, we get a daily line list from them. We have, as we mentioned the other day, tested everyone at that facility. In terms of positives, we have reported all the positives that we had from the last test on Friday. There is one additional death that has been at Bethany Point, but I want to clarify some information. Originally, the number we had listed as that had died on Friday was 21. That number has been corrected. It is, we listed it at 24. That number has been corrected. It was 21 on Friday, and it's now 22. So that is the accurate number. The other one was Summitville. I have those numbers, but I don't have them on the top of my head, but we can take a look at those. I don't know of any new deaths that I've heard from them today, but I know that we've been in contact with them. And we have now every long-term care facility where there is an active COVID case, we are in contact with them every day, asking them, do you have a new case? Do you have a new death? And is there any new information? So that we can do a better job with our strike teams, do a better job with our folks who are in infection control to get back out to those facilities and see whatever we can do to help mitigate it.
Michael, WBEZ.
Good afternoon, Michael.
Good afternoon, Governor and Dr. Box. Thank you for taking my question. I actually have two. This one is for Dr. Box. The Porter County Health Department tells me that it's only being allowed to do 5 tests per week for COVID-19, and that's all they've been given for a county of 170,000. They feel they could handle at least 100 per day if there was a lab willing to work with them. But one lab in Valpo wants like $130,000 up front to do the testing. What, if anything, can be done about this? My second question is, with so many people in Northwest Indiana not having a primary care physician to go about getting a referral to get tested if they feel they might be sick, is there a solution to this problem as well?
So both really good questions. I'll answer the second one first. A couple of things. That's why we went into northern Indiana, Lake County, to make sure that we could do drive-through testing for individuals that were symptomatic. Again, looking at those essential employees, healthcare workers, individuals that were with EMS, fire department, law enforcement, et cetera, to try to make sure that you, and we didn't even require a doctor's order. It was just, if you come through and you're symptomatic, we'll be glad to test you. With regards to the testing in Porter County, that has not been a problem that I've heard. I will tell you that any hospital system that reaches out to us that says that they're running short on tests, we actually are ferrying test kits to them with homemade viral transport media from Lilly and swabs, and we've been supplying hospitals all over the state with that. LabCorp is available across the state, as is Quest, and my understanding from 2 reliable sources now is that LabCorp's backlog has been taken care of, and so they're in a 2 to 3 day turnaround. So I'm not understanding exactly what the bottleneck is with testing there, but you can certainly reach out to me in email, and I will be glad to look into that situation for you.
Tom Davies, The Associated Press.
Afternoon, Tom.
What specifically is your administration doing to plan for an ease to these stay-at-home restrictions when you talked about the third quarter and the fourth quarter? And do you believe that such decisions solely rest with the governors or with President Trump, as he's asserting?
We'll work with the administration. We will not surprise them on steps that we take that are in our authority to take. We'll continue to look at the facts on the ground as we make those decisions. I mean, what will drive us is making sure that we have the capacity to care for those who are in need, that ensures that we don't collapse our healthcare system. That's going to enable us to get back to work. If we don't have healthy workers, we're not going to be able to do our part when we get through this storm. So we'll look at bed availability, we'll look at ventilator availability, making sure that we have the necessary levels, the PPE levels, not just for now, but for the future as well. We've gone through a lesson learned process here too, and what I want to do is ultimately make sure that we have a strategic state stockpile that can be drawn upon at the end of the day, after this is behind us. should there be a second wave come fall, like some suggest there could be, we need to be in a better position than when we first went into this storm. And so we'll look at that. We'll look at our ability to, as the Commissioner of Health, Dr. Box, has alluded to, we'll look at our ability, our capacity to test more people on first and foremost, to test those who are symptomatic. Secondly, to test those who are, on the front lines. We want to make sure that our employers are able to test as well when we're back to work in a full-scale manner. And so all those factors, I mentioned surveillance, that's kind of a big word for being able to follow the positive cases, to do contact tracing so that we know how to mitigate in the future, when folks should be back at work and when they should still remain in quarantine or in self-isolation. And then making sure that we're looking at a proper time period. Again, we look toward the CDC for some of this guidance as well. So when you look at how many days need to go by before they would recommend your numbers be in decline, before they would recommend resuming to those back to normal, so to speak, measures. But when we do return to work, things will be different. And we're working with our private sector partners here in the state of Indiana who want to do everything that they can to make sure that their employees aren't just feeling confident about the safe working space, but are, in fact, safe.
Jake Thomas, Fox 55, Fort Wayne.
Hello, Jake. Good afternoon.
Jake, you have to unmute your own microphone. We'll come back to Jake. Brandon Smith, Indiana Public Broadcasting.
Afternoon, Brandon.
Good afternoon, Governor. So, Dr. Box, you talked about the latest modeling suggesting that the surge will be later than we originally thought, late April, early May. Modeling done by the Institute for Health Metrics and Evaluation say Indiana's actually already passed what they say is the peak for resource use, so beds and ventilators, and that the number of deaths that Indiana should expect from COVID-19 is significantly less than original projections showed. Do you see the same sort of modeling for the number of deaths, which they have at about 600 total? And why does your surge not match up with theirs?
I think our surge doesn't match up with theirs because our surge predictions are based much more specifically on Indiana numbers alone. So we're looking at Indiana numbers, we're looking at what we've done with social distancing, we're looking at with regards to where our numbers are highest in what part of our state, what our hospitalizations look like, and our vent usage looks like. And I really do believe that we have not seen the peak of that surge yet, but I do believe we will be a lot lower, which is the result of all the very strict guidelines and actually, the requirements that we've had for social distancing in this state. And I think that's a really important fact.
You want to talk about how you look at 4 or 5 different models and then bring it to, yeah.
So this is, every week we sit down with a group of very intelligent, incredibly bright data engineers and public health professionals who work specifically with these models. We look at a number of different models, and basically they work together as a team to digest those models and to figure out which model Indiana is actually following most closely. And then based on that, they digest those models for us and then give us basically the report and the information that we need. They look at each model for its simplicity and for its complexity, its positive and its negative. And I've heard Dr. Fauci say multiple times that every model is only as good as what you put into it. So we are using models that we are really trying to model exactly what's happening here in the state.
Well, some of those models, Brandon, that one that you referred to, again, just to repeat what she said in non-medical English, we are looking at Indiana-specific numbers and facts on the ground. Some of the models are looking at the nation as a whole. And so that's why it's important for us to absolutely look at what they're seeing globally, but to bring it back home. And we have tracked throughout this whole process very closely to what the lay of the land truly is today and yesterday and what I suspect will be tomorrow.
Lindsay Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. I'm curious with the federal stimulus checks that should be showing up in bank accounts shortly. Those can't be seized for debts owed to the federal government or state government. But what about to private debt collectors? Are you doing anything, or should anything be done to make sure that money can't be seized by those individuals?
First I've heard of that. Chris, do you have any comment? Or we can make sure that we elaborate on this specific issue tomorrow when Senator Young is here. He may have heard of that, but we're looking forward to that. The date that we've been told previous has been April 24th, when a lot of this funding will see its way into the state of Indiana, so right around the corner, and we'll have an answer before then.
Eric Berman, WIBC.
Good afternoon, Eric.
Afternoon, Governor. Question and a clarification for you. You said there will be tweaks to the executive order on Friday. Given that we're looking for the surge to come late April, early May, is it safe to say that the executive order will be extended, or is there still a possibility that it would be ended on Monday? And secondly, more broadly, 6 of your colleagues in the Northeast say they're going to be coordinating on reopening. Have you, or do you plan to talk with Governor DeWine and Governor Pritzker and our other neighboring governors?
Tweaks means tweaks. I'm not sold on any of them yet. The numbers that we see coming through in the next 5 days, 6, 7, that we'll be able to project or predict what will happen because of those today through Friday, will determine what tweaks are made, whether it's in terms of escalation or de-escalation. Secondly, I remain in close contact, actually speak to Governor DeWine and Governor Brashear because of our unique connection down in southeastern Indiana, but I'm on the phone with them on a weekly basis, separate of all my other conversations with all of the governors, including Governor Pritzker in Illinois and Whitmer in Michigan. So we're talking constantly about the Great Lakes region. I probably have never in my life quoted the New York Times, but I will today, maybe the last time. But the New York Times ran a story, an illustration that called out in a positive manner the Great Lakes states for what we were doing in terms of our mitigation efforts, and how, in their words, we were crushing it, meaning what we were doing because we got in this early, because we acted as a region in the Great Lakes, it was making a profound difference in our numbers. And that gives us a source of optimism. But what we don't want to do is come up short or relax at the wrong time and then see another wave come back. You talk about all of the sacrifices that Hoosiers have made. We don't want to go through this or make a call prematurely and go through this again. That would be even worse. And so we want to be safe, not sorry, and continue to lean into this because we know the difference, the positive difference it's making in our region. And as you state, we're all connected. And so we have talked, Governor Brashear, Governor DeWine, and I have talked about when we get to that day from a regional perspective of reopening or re-entering, what those certain steps may be. We're not there yet. But we've talked about what that day may look like, and there'll be a number of kind of a stair-step approach to if this, then this, if this, then this. But it will be driven by the data, not just our hope.
Our final question is from Kayla Sullivan, Fox 59.
Hello, Kayla. Good afternoon.
Good afternoon, Governor. I have a question for both you and Dr. Botts. I'll start with the governor's question. Do you think the Indiana Department of Corrections is doing enough to protect prisoners? And do you support the release of nonviolent, low-risk prisoners? And then my question for Dr. Botts. Last week you told me you were looking at Monday to get rid of provider requirements to decide who gets tested and possibly expand the number of people being tested. Is that happening today? And do we expect more people to be tested as a result?
A great question, Kayla, and thank you for asking it. I actually wanted to mention it in my opening remarks and forgot. So yes, we got rid of what we called basically a red cap survey where providers had to document why they thought that individual needed to be tested. That is completely gone as of this weekend. And we reiterated with our providers that we felt like we needed to be testing symptomatic people, people that are in the high-risk population, but also people that, may not necessarily need to be admitted to the hospital. They may want to test an individual that is overweight, an individual that has diabetes. We want our providers, and we were very, very clear on a phone call earlier today with chief medical officers and CEOs from over 25 hospitals on the phone today that we want them to test who they think needs to be tested. And that's strictly because we have more testing capacity and we want to use it.
And Kayla, what I would say, and I can have the director, Rob Carter, step up and also elaborate on this, but from the very outset of this, Dr. Box said, and I have repeated, that one of our chief concerns was any contained area of living, whether it be a nursing home because of their specific vulnerabilities, or a classroom, or at the Department of Corrections, those who are incarcerated. We have not had some of the outbreaks yet, and I hope we don't, in our Department of Corrections, as some other states have. This is because I think of our quick and swift action and our ability to quarantine or to separate, whether it's an officer or someone who is paying their debt to society. We have acted very quickly. So to date, I think we've done an admirable job. I do not believe in releasing those low-level offenders. We have sent guidance, the legislature, our administration, and the judiciary to locals in the way that they are incarcerating individuals in terms of those low-level offenders. But we have got our offenders in a safe place, we believe, maybe even safer than just letting them out to avoid contracting this COVID-19. Rob, you want to take it from there?
Thank you, Governor. Yes, Rob Carter, Indiana Department of Corrections. Of the 22 locations that we have around the state, 7 of them are contaminated with the virus. There are 27 offenders in those 7. So I feel like we do have a good handle on this. We have them quarantined. We have them separated. They are isolated. And I think, as the governor said, I think we're doing the best we can do with what we have. And I think we have a good handle on it. Thank you.
And Rob, to put that in perspective, you said you've got 27 facilities. You've also got about 27,000 folks who are incarcerated. And you said 27?
There are 27 offenders that have been infected with the virus. We have 22 facilities. And of the 22 facilities, 7 have been affected.
Yeah. And what's the total population?
There's around 27,000 offenders.
Yeah. 27 is the magic number there.
Thank you for joining Governor Holcomb's briefing. The next briefing will be tomorrow at 2:30 p.m. Eastern.